Welcome. My name is Kelly Owens, and I'm going to tell you today about looking behind the headlines to understand cancer research. Our objectives for this session are to explain how better understanding of health information can improve our health outcomes, to provide you with some tools to effectively communicate with your doctor, and present the challenges of interpreting online health information, as well as providing some resources to help you evaluate media coverage of cancer research. So first of all, let's talk about health literacy and jargon and plain language. And as you can see from the quote uh, in the upper corner, we've heard from a number of people, including this patient survey respondent, who have said things like, I don't understand any of my test results, despite asking my doctor to explain on more than one occasion. So this mismatch in information and communication is not uncommon at all. When we think about the idea of personal health literacy, around this idea. This is the degree to which people have the ability to find, understand, and use information and services to inform their health-related decisions and actions for both themselves and others. And while this may put some burden on individuals, one growing recognition is that the other piece of this is organizational health literacy. And that's the degree to which organizations need to help people find, understand, and use information and services for these health-related decisions. So this idea is that doctors, providers of different kinds, our institutions of healthcare need to also be working toward this end of making sure communication is accessible and in plain language for individuals. So we know that health information is filtered through a very personal lens, and that includes a lot of different pieces, things around individuals' personal beliefs about medical information, about, in our case, cancer, um, personal experiences, what their lifetime experiences have been within their families and for themselves, their cultural perspectives, implicit trust or distrust of medicine, and in the case of cancer, thinking about things like what their diagnosis is and what stage their cancer is at a particular time can really affect how people filter their health information. Age and gender play into that. Dietary preferences can have an impact, especially when we're thinking about nutrition and how nutrition might impact medical care. And the last of these that I want to point out is that we filter health information um, in terms of our emotional state. People may be very aware of a lot of health information that they have difficulty taking in if they're in a very different emotional state. So if you get a cancer diagnosis, for example, you may not be in a state to hear information after that. That's one of the reasons that we suggest people take a loved one or caregiver along with them for major medical discussions so that emotional state can really color their access to health information. We know health literacy and the ability to take in health information can enhance access to healthcare. So greater services and care is possible when you can take information in a more effective way. Improving communication with doctors improves healthcare. Increased understanding of treatment plan makes it more possible for individuals to carry out that treatment plan in an effective way. And this will all enhance self-care for individuals. So we know health information comes from many different sources. People take information in largely as a primary source from their doctors and healthcare providers. But we also know that individuals look to analog copies of information, so books and magazines and newspapers to take information in, doing reading about topics, and also more recently through digital media and social media from a wide variety of sources, as well as family and friends. So information comes from a lot of different sources with a different level of reliability. So I want to talk for a moment about tips and resources for communicating with your healthcare team. So we have a quote from a genetic counseling student who says, I see how people get scared when research is taken out of context. And so these communication pieces really can help reassure people that they're getting adequate care, that they're getting questions answered. So one simple tool is to ask your doctors to communicate in plain language. This is something in terms of that organizational health literacy that is being actively worked on in the healthcare field to have doctors speak more simply, to define jargon, to break things down. So in the cartoon that we have here, this doctor is saying, your pathology report indicates that your tumor was benign. It might be clear to some people, but it might be a little confusing to others. And this patient asks, is that bad? A simpler way would be if the doctor said, you don't have cancer. It's great news, right? Very understandable. So anytime you encounter a situation where the language or jargon is getting in the way of your understanding, stop your doctor and ask them to explain in simpler terms or put it in different words. Um, that is something that they're going to be striving to do and may not always know when they've said something that's confusing. Similarly, you can use the teach back method. And this is a way of repeating important information back to your doctor in your own words. And this gives them a chance to understand if they've skipped something, if they've left something out, if your understanding is different from what they intended, clarify information. It gives both of you a chance to ask questions about that situation, and it ensures safety in terms of particularly medications that are being taken. It is not intended to be a test of what you know. It's intended to be a way to ensure that the information is conveyed in the way that it was intended. So here's an example of that teach back method. Doctor says, tell me when and how you plan to take this new medication. And the person responds, I was thinking I'd take 2 capsules 3 times a day after each meal. They can discuss whether that was really the intention or not. Another tool is called Ask Me 3. And this is a way of making sure that you have the answers to 3 questions before you leave your doctor's office. So with any doctor's visit, you should leave the office understanding what is your main problem? What is the thing that you're addressing? And secondly, what do I need to do now? What are the actionable steps that you need to do to make that treatment plan work? And why is it important? What are the consequences if you do that treatment plan or if you don't do that plan? So really getting answers to these 3 questions for any healthcare treatment are really important. So I want to turn for a moment to digital health literacy. We've been framing health literacy in terms of having one-on-one communication with healthcare providers so far, but we know that people use the internet and other electronic resources to find information and address health issues. And this means of finding information is really important to a lot of us. But there's a lot of traps of online information. So most patients we know are using online resources to access information about cancer. There are a huge number of challenges. So here's a list of just a few of those challenges. Abundance of information, lack of access, jargon, lack of context, sensationalized content, inaccurate content, contradictory messages, lack of expert review, retargeting, and the challenges of technology itself. And I will not say much about the challenges of technology. We know that limitations and barriers to access of technology or ease with technology can be a problem. What we're going to focus on, though, are the pieces that are actually online once you've reached that information. So the first of those is that there's really a huge amount of information out there, and too much information can be overwhelming. So this is a couple recent Google searches on breast cancer and prostate cancer, and you can see that for breast cancer, there were over 478 million different results, and for prostate cancer, a little less, 106 million results, but that's a huge amount of information to wade through. So that really leaves people with the need to condense that in some ways. And most people turn to media. So things like blogs and online forums and websites. Media is very accessible, but it can be unreliable or sensational. And a number of the headlines here highlight just that. So things like BRCA gene mutations also linked to salivary gland cancer. Gene that causes cancer probably doesn't increase your chances of dying. These are really sensational headlines. And that sensationalized content, things like a cure for cancer, Israeli scientists may have found one. This was an article that we profiled recently at Force, where a newspaper had highlighted this particular company's work as a cure for cancer, but there wasn't a lot of published data to validate that. And similarly, on the right, how a simple blood test could reduce cancer deaths talks about a test that is perhaps a useful test, but still is undergoing some evaluation by the scientific community. Often headlines are written to elicit emotion, which you can see in the people in the picture below. They're meant to grab your attention and get you to read articles, but don't necessarily always reflect the content of those articles or whether that information is valid or not. There can often be a lack of context. So in the media headline on the left, the headline reads, "A new study linking asparagus to cancer is freaking people out. Here's how concerned you should be." So asparagus is spreading cancer. That's what they're trying to tout. When you look at the scientific journal, it says asparagine bioavailability governs metastasis in a model of breast cancer. It's not very accessible, but when you break down what the content of that science article says, they're looking at one component of many in asparagus that's found, and this component is found in most foods. It's required by the body to function, and it happens to increase the growth of cells in mice in the lab at high dose. That's quite different from this maybe we shouldn't eat asparagus idea that the media headline was suggesting. There's also a lot of just frankly inaccurate information, and headlines are often the worst for these. So here's several. New study of UK variant, this is referring to COVID variants, may have a higher mortality rate, perhaps as high as 61%. Deadly breast cancer gene is a myth, and drug that prevents Angelina Jolie breast cancer gene nearly ready. So in each of these cases, no, these are not accurate headlines at all. And they're not accurate for the following reasons. In the first case, the one about the COVID variant, this is a misleading statistic. It's relative risk, not absolute risk that they're talking about. Mortality did not increase from 1% to 61%, which would be incredibly alarming. The increase in mortality was from 1% to 1.61%. It is a 61% increase in risk relative to that 1% risk. It's of concern, but not nearly as much of a concern as a 61% mortality would be. In the case of the deadly breast cancer gene title, that study is asking a different question. Mutations in BRCA1 and 2 are linked to an increased risk of cancer, but this study looked at survival. It showed that people, once they have breast cancer and had a BRCA1 or 2 mutation, were not any more or less at risk than people who had breast cancer and didn't have one of those mutations. So looking at survival, not at overall risk. And lastly, the headline, "Drug that prevents Angelina Jolie breast cancer gene," that it is showing inaccurate timing and is not really reflecting the state of the research. So these were animal studies on a cancer prevention study that it turns out didn't pan out in humans. They weren't nearly ready. Also, I'll point out that drugs don't prevent genes, drugs affect protein function. And so, and there's not a gene named the Angelina Jolie breast cancer gene. They're referring to one of the BRCA genes. So wrong on a number of fronts. We also see in the media a lot of contradictory media. In this case, both of these headlines about a study on milk are about the same scientific study. One headline says, "Dairy milk consumption linked to 80% spike in breast cancer risk." That's a huge worry. And the other study, scary headlines aside, drinking milk does not cause breast cancer, is actually more reflective of the reality. There may be a slight impact of fats in milk. Again, nutritional studies are very difficult to do, and it doesn't seem that it's associated with breast cancer risk. We often see, looking at social media as a source of information, there's lack of expert review. So headline of one of these articles is, "Unlicensed medical cures are flourishing in closed Facebook groups." Whether they're closed or open Facebook groups, we see a lot of information that do not have scientists moderating those. It's a pretty free, open discussion and often goes in directions that aren't accurate. Similarly, we see celebrities, like in this case, Gwyneth Paltrow, Her Goop lab treats fake science as if it were real science. A study out of by a group of researchers that was published in the Journal of the National Cancer Institute looked at 200 popular articles on social media based on cancer information and showed that 33% of them had misinformation. And of those, 77% could negatively impact cancer treatment if people acted on that. That's a really large impact potentially of misinformation. We also see on social media that ads are being targeted and retargeted. This is probably not news. We're seeing a lot of this in coming up in the media, but that the algorithms that a lot of social media run on prompt people to see articles based on common interests or uh, various ways that they come up to the top of their feed, but it doesn't mean that that makes it more valid scientifically or has medical validation. So just because YouTube recommends a video doesn't mean it's an accurate video. So if we're not getting information from the media, scientific studies would be a source of information, but we often see that research articles are very technical and often inaccessible. So this is a list of a number of different science studies that correspond to some of the headlines that I showed a moment ago. And one of the first things I'll point out is that they're often in peer-reviewed journals. Scientists have looked at the validity of the work that's being done. So they're very reliable in that sense, but they're often at journals that are behind paywalls. So people can't get at the original science articles. Additionally, there's a lot of jargon. So just looking down this list, there's a lot of words, if you're not in a scientific field, don't particularly have any meaning. There are particular scientific terminology or names of things and make it very difficult to read a lot of these papers. Additionally, while there's an abundance of information here, it's hard to sort through what's important, what's relevant to a patient versus of interest to understand the science at a basic level. Is the science done well? It's hard for someone who's not in a particular field of science to understand another field of science, never mind someone in the general public. And then how far is it from clinical use? And I've highlighted in yellow a couple different studies here. One is a phase 1 clinical study, and that's a very early stage of research where people are still trying to determine, is it safe to use in people at all for this particular drug? As opposed to a phase 3 trial, like the Keynote 177 study, where it's been studied in people fairly extensively to understand whether it's useful, and that would be the phase right before FDA looks at a drug for whether they would approve it or not. So it's fairly late in the process of coming to the clinic. And then sometimes you don't have any indicators of that. So the very last article, accurate classification of BRCA1 variants, so different mutations in the BRCA1 gene, that sounds like it could be clinically useful right now. But the fact is, in this paper, they're looking at a technique that is potentially useful for evaluating mutations, whether they're harmful or not harmful, but it's not been validated for clinical use at this point in time. So that's one of the reasons that Forrest developed the Xray program. And the Xray program isn't looking at X-rays of images, it's examining the relevance of articles for you. So trying to really look at science articles that have come up in the media and evaluate them in a way that is accessible to the general public. So trying to break that scientific jargon down into plain language so that it is understandable and pull out the pieces that people can use for making healthcare decisions. So as one of our Force volunteers said, there's so much toxic disinformation in the world of hereditary cancer. Force's Xray program is an antidote, and that's what we'd like to think. We started this program to look behind the headlines, to bring reliable information about cancer research to the community, initially under a CDC grant, and that's been followed by another CDC grant to support this program. Our initial focus was looking at young women with breast cancer, and we've expanded that to all stages of breast cancer, as well as a number of other hereditary cancers. So what are in our Xray reviews? We include a plain language summary, so a simple breakdown of what that science article was about, how relevant it is for use in the clinic. Is it useful for patients today? What the key findings of the study are, what the details are of that research, some expert guidelines, some question prompts, and related clinical trials, as well as related resources and ratings about the media. It's searchable and printable. So let's look at a little bit of that. So I mentioned this study about asparagus before, and the scientific journal, that this title is not the most accessible title in the world. And next, this is our X-ray summary of that. So is asparagus linked to breast cancer metastasis? And we rated this by a couple different criteria. So looking at the relevance was low. This was a study in mice. It's not in humans yet. It's not clear that it will ever be relevant to treating cancer in humans. The strength of the science is medium. It was not a bad scientific study, had a lot of worthwhile things. It had some limitations. And you can see on the research timeline that it's animal research. So this gives people an indication of how useful is that to you. The next, that deadly breast cancer gene media piece, the original scientific study is germline BRCA mutations in young onset breast cancer, or the POSH study. It's the name of a study looking at a group of young women moving forward. And our X-ray review of the POSH study shows survival and mutation status in breast cancer patients under 40. This is quite relevant. It was in humans. It's not relevant for all breast cancer patients because they focused just on people under the age of 40 for this particular study, but the science was very well done, and you can see that is rated high. So we give people an indication of how useful this is to them. For all of our X-rays, we give a highlight of the finding. We call this the above the fold version. So for the POSH study, this is showing you that, what the study is about, why it's important, what the major findings were in a really brief way, and then what does this mean for me? How does this affect treatment potentially? There's also an in-depth or below the fold version of that that can be expanded, looking at the background of the study, a little more context of the science, what the researchers wanted to know, who they looked at in some detail, more details about the study and its limitations. And in all cases, we have these hover over words that are highlighted that give you a pop-out glossary definition to help with some terms that might be less familiar to individuals. And each of the studies has expert guidelines. These are national guidelines about standard of care, as well as enrolling clinical trials that are associated with the topic of that particular review, and questions to ask your doctor. So if a particular review is useful to you in terms of thinking about cancer decisions, here's some prompts to foster discussion with your doctor. We also go back and rate the media. So we pick articles based in part on the information and how relevant it is to the community, and those in particular that are getting a lot of media coverage or where there's confusion or misinformation in the media. And you can see these are the articles that were written about that asparagus study. There's a large range of them. There's often a mismatch between how relevant it is. The study was not particularly relevant clinically. It was basic research, but there was a lot of coverage of it. It was easy to write headlines about. There's a range of quality of the media. So we give a rating of 1 to 5 stars. Some articles in the media were written quite well. Others were written poorly. And we evaluate that media based on a set of rubrics, a standardized way of looking at the quality, and do a breakdown of why we rated a particular piece in a particular way. So in the case of this article that got 1 star, the headline's very misleading, the article misstates a number of things, and so on. All of these are searchable, either by cancer category, the date it was published, the relevance to particular individuals or keywords, or you can view all of them in a reverse chronological order. And I mentioned that while we started looking at breast cancer in young women, we've expanded that. We have portals that group review articles by cancer type to make them a little easier for people to find. So that includes breast cancer, metastatic breast cancer, colorectal, endometrial, ovarian, pancreatic, and prostate cancers. And we'll continue to expand that as time goes on. This is also printable, so you can take copies to your doctor if there are questions that you have that would be useful. So we cover a number of these every month, but we can't cover all the media that's out there. So there's quite a bit of media coverage at different points in time. And we want to leave you with some tools for evaluating media for yourselves and resources to use in doing that. So as a genetic counseling student said to us, I see how people get scared when research is taken out of context. These tools will help empower me and empower patients to make their own decisions about information they find in the media. And that's really our intention, is to empower people to make their own decisions about the information that's out there, but really have an understanding of what's reliable and what's not. And so we'd encourage you to use your X-ray vision to look behind the headlines like we do with our X-ray reviews, to check information before using it and before passing it on to others. And so checking that information means a number of different things, looking at the source and the content and the context and the relevance. And I want to step through just a little bit about how to do that and a few short tips. So checking the source is probably one of the most important things you can do. And the end of a website link tells you a lot about that source. So resources that are websites ending in .gov are government agencies. These generally tend to be very reliable sources of information that have been vetted by lots of different scientists over time. So this includes information coming from the CDC, from the National Institutes of Health, and from the National Cancer Institutes, for example. Websites ending in .edu are from academic institutions and universities. And these are also very reliable sites. It's scientists putting out information about medical information or content information from hospitals. One caveat is to watch out for press releases. These are not necessarily bad, but they tend to be a little one-sided. They're touting a particular thing that came out of university and may not give you as much of an idea of what the controversies in the field are or what the limitations of a study might be. .org at the end of a website indicates it's from a nonprofit organization. And I've put FORCE up here as an example. I think we're a very reliable source for all of our X-ray reviews. I'll note that we use external, independent scientific review of all the articles we put out as a way to try to make sure we're being clear and valid in our information. And that's true for many nonprofit organizations, but there's a range. It's important to understand what the mission of an organization is, who their advisors and board members are, in terms of whether you find them reliable or not. Similarly, .com at the end of a website indicates a commercial or for-profit company. Many of these give very reliable information about medical things, but they do have an agenda. They're trying to sell something. That's the intent of their business. And that can range. So understanding what their business is, who the owners are or governing bodies are, what they're trying to sell, why they're putting this information out for you is an important piece. And in the case of this particular resource, you can see that it's not a particularly reliable source. In this case, using an extension called NewsGuard helps evaluate different websites. And you can see that this one is defined as not being very credible on a number of different fronts. So deceptive headlines, doesn't correct or clarify errors, isn't very transparent about information. And so their summary is that this website violates a number of basic journalistic standards. This would not be a website that you'd want to take a lot of information from. So you also want to look at the content. So is the content current? Websites, lots of information persists on websites for years and years. Is that information out of date? Have there been changes in the field since it was published? Is it neutral? Look for terms like miraculous and cure or holy grail, which you can see in this top title, as signs that it's not the most neutral coverage of that topic. Look for conspiracy theories. We're seeing more and more of this. So terms like scandal or hoax. In the case of the two headlines below about breast cancer implants, one says, Worrying evidence of a new scandal regarding breast cancer implants is emerging. That tells me that's not the most neutral source. The headline below it, breast implants linked to rare cancer are recalled worldwide. That's a more accurate coverage of an issue that is an important issue about breast cancer implants. Are experts quoted? Are those experts legitimate? You want to look for information of someone who is a practitioner in the field that they're being quoted on. You wouldn't go to a physicist to ask a question about heart disease or about cancer. You want to make sure that the expert is an expert in the field that they're addressing. Are the statistics clear? So things like the relative risk versus absolute risk that we talked about earlier. And does the content make sense? If it, flags things for you, there may be things there that are inaccurate. Do a quick Google search, double check it with other sources, see if there are other things that match it in the media, or is this really different than what the rest of the media are saying? And confirm before sharing. So this is an example of an email chain letter that was sent around at one point in time. And I've gotten a number of these from family members in different ways. So wanted to highlight a number of different things. It's important to look when you get something like this, whether it's on social media or email, is the cited authority a real person? So Irene Ken, assistant professor at Johns Hopkins University. Is this a reliable academic institution? Is there content on their institution's website about this? Does the information look correct or incorrect? And lastly, use a fact checker site like Snopes.com. So in looking at this particular one, I'll point out that Johns Hopkins is a reputable university. But when you look for Irene Ken, this is a person that's not on the faculty at Johns Hopkins. I've underlined protein molecule DNA in this. DNA isn't a protein. That's something that might or might not be flagged, but you could do a quick Google search and say, what is DNA? They make the statement in here that viruses aren't a living organism, but a protein molecule, it's not killed, but decays on its own. So viruses can degrade with temperature and dryness. That is true. But viruses can also be destroyed by your immune cells. And we rely on this in terms of immunity. So there's information in here that's not accurate. And when we go on to look, if you did a search of Irene Ken and Hopkins, this is what comes up on a Google search. COVID-19 misinformation claiming to be from Johns Hopkins, put out by the Johns Hopkins site itself. So they're saying this isn't from us. And similarly on Snopes, or if you look directly on Snopes, did Johns Hopkins publish this excellent summary of, and it's the fact check by Snopes is that it's misattributed if you followed this out. So there's a number of different ways to look at confirming this information. Absolutely try to confirm information before sharing it. The last thing is a little more subtle. So checking the context and relevance. This is information that might otherwise seem accurate, might be current, might be neutral, but is it really relevant? Is it appropriate for the situation that you're making a decision on, or that a friend or family member might be making a decision about? So was this human research? What was the phase of research? What was the group studied? Are the results generalizable? Are the results clinically relevant and valid? And do the results confirm or contradict other research? So in the case of the titles here, this first one about soy, protective for breast cancer survivors, is a diet study. And as with many nutrition studies, there are some major limitations. It's really hard to get people to eat in a particular way with a particular guideline. So it is difficult often to make very strong conclusions about these studies. We see subtle effects, but they should be viewed with some caution. The second title, Chilies Could Help Beat Breast Cancer, is about very early research. It's an exciting, promising area, but it's unclear whether it will really pan out as being an issue that's relevant or important for people. The third one, FDA press release about a oral hormone therapy for treating advanced prostate cancer. This is really exciting if you have metastatic prostate cancer, but it's not necessarily relevant for the person who's dealing with early stage prostate cancer or a different kind of cancer. So really looking at who this is aimed at is important. And then the last headline about 23andMe that was approved by the FDA for a DNA test. This is a test of particular mutations in BRCA1 and 2, three mutations in particular, but not the vast majority of mutations in either BRCA1 or 2 or in any of the other genes associated with breast cancer. So it's very limited, might be useful for some people, but has a very narrow audience in some ways. So I want to just finish by thanking you for listening to this talk and hoping that you have learned some things about health information, about some techniques like using plain language and talk back and ask me three to talk with your healthcare providers to really get them to slow down and explain information in a way that's understandable, to understand a bit about the challenges of looking at health information in the media and what different traps there are about lack of information and content. A little bit about the Xray program and what we've done to try to make that more accessible for individuals, and tools that you can use in looking at the media for evaluating what the source and content and relevance of different media that you read are. So I hope you found this a useful session, and um, there are resources here on the Xray program and the different kinds of cancers that we have reviews on. And I hope you'll find those useful in the future. Thank you very much.